hearers if you could just introduce yourself.
Sure. I'm Jeff Zeig, and I'm the director of the Milton Erickson Foundation in Phoenix.
To begin with, could you tell us how you were first introduced to hypnosis?
Sure. I was in my master's program at San Francisco State, and I had an opportunity to do an internship at a community hospital inpatient unit. And the director of the hospital, a psychiatrist, Charles O'Connor, was one of my supervisors, and I asked him if, as far as supervision was concerned, could he teach me something about hypnosis? It seemed interesting to me. And he said, well, come to my office on Saturday and I will do a session with you. So with some trepidation, I went over to Charlie O'Connor's office, and I was nervous. I was scared because I didn't know anything about hypnosis. And I was unconsciously drumming my fingers on the arm of the chair. And Charlie, who knew something about Erickson, did a utilization technique. He said, Jeff, drum your fingers more. Drum them faster. Watch as your fingers slow down. And suddenly, this was so fascinating to me. I didn't have the word utilization in my vocabulary. But I said, okay, well, that was, really interesting. And what should I read to learn more about this? And he said, read Milton Erickson. And I said, who? He said, well, Milton Erickson. And the only book that was out at that time was Advanced Techniques of Hypnosis and Therapy. There was no other books really about Erickson other than this compendium that Jay Haley had put together. And it was a very expensive book at the time, and I was a very poor graduate student, but I ordered the book. And it stunned me. This was light years beyond anything that I had conceptualized as psychotherapy. And so I immersed myself in that book and started learning about Erickson. And then I used trying to understand utilization, which has become a foundation in my approach to hypnosis. Most of my writing over the last 10 years has been explications of various aspects of Erickson's utilization technique. And utilization in Ericksonian therapy, utilization is really the foundation of solutions. So all of Erickson's cases are steeped in utilization. And then I became fascinated with Erickson, and then I started my excursion, which has now been some 35 years, into learning to refine my method of using hypnosis and psychotherapy, and thinking from hypnosis that informs my psychotherapy, regardless of whether or not I'm doing formal hypnosis.
Could you share your own understanding or definition of hypnosis?
Mm-hmm. Well, I just wrote a paper and submitted it to the American Journal of Clinical Hypnosis, and basically my perspective was that hypnosis doesn't exist, and that hypnosis is a construct of convenience. It's a title that we put on our experience, and there's three components of experience: a contextual component, a psychological component, and an interpersonal component. So if we look at the phenomenology of hypnosis, we would say that hypnosis was composed of a context where you directly or indirectly define the situation as hypnosis. It's composed of a psychology. The psychology, the individual psychology, is that you change your attention, you modify your attentional processes, you modify the intensity of experience. So the intensity of experience becomes more or less vivid. There's a plasticity of experience. For example, relaxation could be more vivid. For example, the passage of time could be less vivid. And the third component, psychologically, is dissociation. Dissociation in three senses. Dissociation meaning that something just happens, like images just happen, memories just happen, or there's a sense of being a part of and apart from the experience, which would mean that there's a sense of being here and not here at the same time. Hypnotized people often say, well, I was here, I knew I was here, but I was there. I was involved in the imagery of the moment, or I was involved in the memories. And also a sense of destabilization. So if you have a context defined as hypnosis, if you have changes that happen psychologically, a change in attention, a change in intensity, and a change in dissociation, and you combine that with a change in interpersonal responsiveness. The interpersonal side of hypnosis is that people start to respond to the implication of the communication. They start to respond to the meaning of the communication. They respond to the covert level. Now, if you take those 5 factors, defining the context, the three psychological changes, and the change in interpersonal responsiveness, and you put those together in some combination. What combination, we can't say, because some people just change their attention, they'll say, I'm hypnotized. Some people will start to have dissociative experience, they'll say, I'm hypnotized. Some people, you say, let's do hypnosis, you just define the context, and they say, okay, I'm in a trance. Some people need that interpersonal responsiveness to say, I'm in a trance. But if you have some combination of those things, people will say, they will title their experience, I'm hypnotized. And so hypnosis is a construct of convenience, but so is love, and so is curiosity, and so is good humor. They're just a construct of convenience. And by deconstructing hypnosis into its component parts, we can set into motion a series of events that we could call hypnotic induction. And when people start to experience that series of events, then they will title their experience, I'm hypnotized. So I think that it's wrong to think about hypnosis as a singularity. There's no singularity to love. There's no singularity to good humor. It changes over time, and the elements that compose good humor or love or hypnosis change over time. And so thinking about hypnosis as being a scientific fact is a very difficult and challenging thing to do. Hypnosis is more in the realm of a very personalized experience.
You've seen a lot of developments over, say, 35 years of working at. Do you have some predictions for the future as far as the field of hypnosis?
Sure. The only prediction is that if you want a certain way of making a fool of yourself, just predict the future.
Fair enough. Do you have a favorite story about hypnosis that you could share with us?
Well, a favorite story would be, for example, my introduction to Erickson. So in 1973, I visited Erickson for the first time. I had written a paper about using Erickson's techniques of utilization to work with psychiatric patients, inpatients, schizophrenic patients who are having auditory hallucinations, and demonstrating that you could use hypnotic techniques naturalistically without formal trance to modify auditory hallucinations. And so that was an entree into visiting Erickson. But I was still pretty young and not very experienced with hypnosis. So I came in 1973, in December of 1973, to visit Erickson for the first time. I drove from a meeting. It was an SCH meeting, and actually Herb Spiegel was doing an advanced course at the SCH meeting in Newport Beach. And so I went from the Bay Area, San Francisco, where I was living, and I drove down to the SCH meeting, attended Spiegel's workshop, and then drove across the desert to visit Milton Erickson. I got there about 10 at night, and I was a little disoriented, and I was intimidated by the idea of visiting Erickson for the first time. And I walked into his home. I was going to be his house guest, and I don't even remember how that was arranged. But for those first 3 days that I was there, I was to be his house guest. And so I walked in. It was like 10 o'clock, maybe 10:30 at night. I got there late. I was a little embarrassed about that. And then I knocked on the door, and I had met Erickson's daughter because she was a friend of my cousin's, but that was years before, and only on one occasion. And she introduced me, and there was Erickson wearing purple because he was colorblind, and that was his favorite color. And he was seated to my immediate left. And then what he did to say hello to me, because she said, this is my father, Dr. Erickson, Erickson did this. And I was standing there cataleptic because nobody had introduced themselves to me like this before. I didn't have a reference experience for understanding how to deal with that moment. And so I was just stunned. And Roxy took me to the next room and said that her father was a practical joker, but that was no practical joke. That was a complete induction of hypnosis. where Erickson demonstrated the dissociative kind of movement that somebody would have as they go into trance. He fixated my attention, captured my attention, and then subtly suggested, probably he used a little dissociative technique, destabilizing technique, probably he defocused his vision, looking past me, through me, probably paced my breathing, and then looked down in the midline of my body, suggesting go down inside. So all of the elements that I described before that would comprise hypnosis were there. There was a contextual definition that was done indirectly. Indirectly, he indicated this was a time for hypnosis. He indicated the psychological opportunity for dissociation. He indicated a psychological opportunity for changing my attention. And he indicated that I could respond to the subtlety of his technique, to the implied message, because the whole technique was nonverbal. So it was an elegant demonstration. All of the components were there, but it wasn't done in any formalized, ritualized way. And following Erickson for the next 6.5 years, I never saw him do that induction again. So he had seemed to just invent it on the spot, which was perfectly fine, because if you're thinking about your intention, what is it that you're trying to elicit? I'm trying to elicit these components of experiences. If I elicit these component experiences, I can tell a story to do that. I can use a formal technique to do that. I can use a nonverbal technique to do that. I can use whatever is happening at the moment to do that. And then all that I am doing is I'm placing those props. This is like a theater. I'm placing these props on the person's psychological stage. If the person chooses to play with them, these 5 props that I talked about, they're going to define their experience as I'm hypnotized. Once we can get to that mentality, then it opens up new worlds for understanding psychotherapy. You could start to think, for example, about a car, a metaphoric car, where the front wheels and the back wheels would represent different aspects of human experience. So the 2 front wheels would represent thinking and behavior. The back wheels would represent state, meaning sensation and affect. And then the other back wheel would represent physiology. Now, normally in psychotherapy, we give people instruction, psychoeducation, about how to change their behavior and how to change their thinking. And we understand that if you turn the front wheels of the car, the back wheels are going to come along. But when we start learning hypnosis, we learn to directly change people's state. We learn that you can actually talk to the physiology, and the physiology will respond. So by virtue of having studied hypnosis for 35 years, I'm very comfortable and confident in working with people directly to change their emotions and directly to change their state. And it's using a series of these kind of poetic, dramatic techniques that will help to elicit changes in people in their state and also in their physiology, that these state and physiology are not dependent on quote-unquote unconscious forces, but they're experiential. If you want to instruct people and do psychoeducation, you tell them, which is good, to change their thinking and change their behavior. But if you want people to change their state and change their physiology, you need to use experiential techniques. So I don't even really necessarily consider myself a hypnotist, but I consider myself a hypnotically informed psychotherapist, because by virtue of all of those years of studying hypnosis, I think in terms of hypnotic principles, although formal hypnosis is something that perhaps I only do 10% of the time in the psychotherapy that I do.
As I've gone to the different international meetings, it's really struck me that the Erickson Foundation's at a international level has been one of the primary sources of spreading education about hypnosis. Could you just tell me a few minutes worth of the state of the Ericksonian Foundation and its mission and what you're up to with that?
Yeah. Well, we started the Erickson Foundation as a way of honoring Dr. Erickson. It was to coincide with his 78th birthday. And then pretty soon into starting the Erickson Foundation, it wasn't that we wanted to start a school of Ericksonian psychotherapy. The word Ericksonian, probably as psychotherapy, Probably the first print of that was in 1978 when we published the brochure for the first International Congress on Ericksonian Approaches to Psychotherapy and Hypnosis. So it wasn't like we were trying to establish a school of Ericksonian thought or a school of Ericksonian therapy, but to take the principles that Dr. Erickson championed and invented and bring them into the broader nexus of psychotherapy. So the first way that we did that was that in 1985 we organized the Evolution of Psychotherapy Conference. And at that conference, that was like Woodstock for psychotherapists. The conference was held in December. It was sold out on Labor Day. 7,200 people came. You couldn't get a ticket to that conference after Labor Day. We used 19 hotels in Phoenix to have that conference. A very complicated bus system. So the people who spoke at that meeting were like, Carl Rogers and Joseph Wolpe and Virginia Satir and Murray Bowen, Carl Whitaker, Jay Haley, Paul Watzlawick, R.D. Lang. So it was an incredible conference, 25 faculty. And I watched in my suite as 78-year-old Joseph Wolpe introduced himself to 83-year-old Carl Rogers and said, "We've never met before." And Rogers and Wolpe agreed they hadn't. So that gives you some idea of where psychotherapy was in 1985. And so what we've tried to do at the Erickson Foundation is to bring together leading figures in psychotherapy and describe some of the underlying commonalities that make psychotherapy work, and adding this experiential aspect into our programs. So the Erickson Foundation organizes the Evolution of Psychotherapy Conference. We organize the only multidisciplinary brief therapy conference in the world. We organize a couples conference on a regular basis. We organize the Erickson Congress. We have a press. We have our intensive training program. There are 135 institutes currently around the world that are loosely affiliated with the Erickson Foundation. I've taught psychotherapy in 40 different countries. So there's a large interest around the world in people learning about Erickson. Now, when I started the Erickson Foundation, I thought the movement would maybe last 10 years. And so here we are 30 years into the movement and still growing very strong internationally. The last Evolution Conference, we have the Evolution Conference every 5 years. The last Evolution Conference had 8,600 people. It was the largest conference ever held solely on the topic of psychotherapy. APA and APA are larger conferences, but they're not solely on the topic of psychotherapy.
Thank you very much for sharing that and for taking some time with me today.
Pleasure.